Well, thank you very much, and thank you all of you for coming tonight. It's really great to be here with Sustrans, who've delivered some great schemes in the past, and I can see lots of Living Streets people and LCC people and others, so thanks for coming tonight. Yeah, this is just a top-line presentation to kick off for the evening, and I'm really pleased to be here with Dr. Will Norman, our new Walking and Cycling Commissioner, London's first Walking and Cycling Commissioner, though I pay respects to Andrew, who is here, who was our previous Cycling Commissioner, and for the great work that he did. Before you meet Will, I was wanting to tell you a little bit about our work to put active and sustainable transport right at the heart of what we are doing in London. Can the magic person with the fickle finger of fate move on to the next slide? Thank you very much. I expect a lot of people here have heard about the Healthy Streets approach already, so forgive me if I'm telling you stuff which you're aware of, but it's really important and we want to get this message out. You may know the Sustrans board member who was very much the brains behind this set of thinking, this new methodology, this tool, is Lucy Saunders, and I think I've seen her. Hey, there she is. Hello, Lucy. She's did some great work within TfL, and it's that work that we are making use of and building on and trying to spread. Just wanted to start off by saying briefly why we think it's so important to take a new approach to transport in London and why we should be doing this. It is, in some senses, quite simple, and I hope in our new Mayor's Transport Strategy we will actually have a health target for the first time ever. It's very clear that the majority of the top causes of illness and early death in London at the moment are related to inactivity. So we're talking obesity, high blood pressure, type 2 diabetes, high cholesterol, that kind of illness. And we know that the most effective way of building physical activity into daily lives is during people's journeys, their daily travel. So an absolute demonstrable link between activity and prevention of ill health. We've got to get onto this agenda very, very seriously. Most Londoners could get the minimum physical activity they need to stay healthy from walking or cycling trips. When we looked at the data, is very clear that there's a very high correlation for walking with using public transport, and there's also a very high correlation between inactivity and having a car and driving it. So very, very clear messages. So the obvious conclusion for Transport for London, which is the Mayor's Strategic Transport Authority, is that we have a responsibility to act to curb the effects of London's inactivity crisis. I have to say there are other very, very important reasons as well that I won't go into detail tonight, but I was this afternoon with my other deputy mayoral colleagues, including Shirley Rodriguez, our environment deputy mayor, talking about how do we move towards achieving London as a zero carbon city by 2020. And it's very clear that this is not just about having change of fuels and getting people out of cars. It's about actually people having an active lifestyle, walking and cycling. Slide 3. So the Healthy Streets approach, you will have seen this very much. We're now taking seriously this responsibility to get people into the heart of the transport system, and we've adopted the Healthy Streets approach, and it's simple. 80% of travel in London happens on our streets. The most effective way to get people to travel actively, to make these streets better environments, more appealing places, safer places to walk, cycle and spend time. So the Healthy Streets approach uses 10 indicators of a healthy street to guide our decisions towards creating streets for people a bit like an assessment tool, really. We want to see pedestrians from all walks of life, so a social mix. We want people to find it easy to choose to walk and cycle. We want roads, if there are the roads, to be easy to cross. We're looking for things that make the environment better to be in, shade, shelter, places to stop, reductions in noise, people feeling safe, things to do, the environment being more relaxed, greener environment if we can, and of course cleaner air, really important priority for the Mayor, clean air quality. The indicators cover all those key areas that I think need to be improved in London, and many of them link back to one of our key issues, and we will be talking much more about this in our Mayor's transport strategy, is the need to reduce motorised vehicle use in London, modal shift, and I'm concerned for deliveries and freight as well as the private car use. Slide 4. So what we're doing now, it's not a small change for London. It involves, in terms of our planning, it involves the fact that in our new business plan that was published at the beginning of December last year, we've allocated 2.5 billion to a new Healthy Streets portfolio, bringing all the road and street investments together into a fund that can be assessed against those Healthy Streets indicators. So this includes an average of about 154 odd million a year for investment directly in cycling, and that's around the Dutch and Danish levels of investment at about £17 per head per year. And I think we all understand how important that is. And now, most excitingly, we've got Will appointed as our walking and cycling together, bringing these important remits together. And of course, the investment isn't the whole story. What is required is a fundamental change of approach to transport in London. And Will and I are absolutely checking everything we do now for what the impact is on walking and cycling and how we can make these things right at the heart of what TfL does. One of the things that I've been doing before Will arrived was making sure that the internal decision making of TfL is much more joined up and coherent. You know, there is no hiding place now. There is no internal arguments to be had. It's clear what the policy is, and it's clear internally how those decisions are made, and there is a clear policy path and leadership now, as well as a budget. Slide 5. So we did publish that policy last week, the Healthy Streets for London policy, which does lay out the shared vision for London streets. And it is a statement of intent, signalling how we intend to transform the city for the benefit of Londoners' health and well-being. If you haven't seen it, it's on the TfL website, and I would really be grateful if you would have a look at it. And, you know, if you buy into it, I hope you do, start talking about it, because we want everybody to understand this concept. There's lots of journalists I would love it if they didn't ring me up and talk about car congestion, but if they rang me up and talk about moving people around. That mindset, we've got to shift it. The document explains how thinking has got to be applied to every level, changing local streets, providing better walking, cycling, public transport network, planning London's development and growth around a more active and sustainable transport, and the benefits for people first. So what's next? Will is taking forward the next round of planning, and he will be telling you about that, I'm sure. We also have a Mayor's transport strategy which covers the whole piece, which we are preparing for consultation in May this spring. So it will be embedded in there, the Healthy Streets approach, and that document is the 25-year story. It is saying this is going to be not just what we're going to do within this 5-year business plan period, but what we're saying is we want this to be a direction of movement for the next 25 years. And because our transport strategy is the first document out, it will also then be echoed. It will set the trend for the London plan, for the environment strategy, because we're working together to make all of these programmes tie in closely together. The support and involvement of local councils is going to be really, really important. 95% of London's streets are owned and run by the boroughs, and we have a very important policy tool in the Mayor's Transport Strategy to influence them, but equally we've got the local implementation plan funding regime. Although the budget is obviously tight, we've protected our borough investment programme to make sure that the LIPS programme can tie in to helping us deliver healthy streets, because there's lots of boroughs out there who really want to make their streets better, healthier, and the programme will be there for them to fund them. We will be tying all of this into the Mayor's spatial strategy for the whole of London. So last slide. So I think it's a pivotal moment. It's a time, I think, when we can move, getting those cycling and walking schemes, from the embattled fringes, being the iconic schemes, to being mainstream activity for transport development in London. This is about making the programmes and the change mainstream. Without making this shift, London could face a future of car domination, and I think we've looked at that, and it doesn't work for us. It doesn't work for our health. It doesn't work for our environment. It doesn't work for our road space management either. We haven't got the road space. So I'm confident this will be a good direction of travel. So I'm really pleased to, I think, through you, Chair, hand over to Dr. Will Norman and give him a chance to talk about what's happening next. Thank you.